Alrighty, so I can see that speaker moving, so assume you can hear me just fine. Kind of a bit of a delay there, but for most of you, it'll be transparent on YouTube. The slides just loaded up a couple minutes late. What we're going to talk about tonight is healthcare, and really, I'm striving not to make this a political discussion because it shouldn't be, but there's a lot to it, and there's a lot of the things in the book that we're going to talk about, or that the book talks about, that have changed. So, healthcare, long-term disability, that hasn't changed, but even disability itself is kind of a political issue. And then long-term care insurance, which is important because people are living longer, and you need to have some preparation for that. So, they're going to go off here and talk about why healthcare's gone up, define some of the sources of health insurance, appraise the source of government health care, recognize the need for disability income. So disability income is definitely important. And that's, for you, example, getting hurt on the job, which especially if you're in a rough profession or as you get older, people tend to get injured more often. But unfortunately, the whole system is full of abuse, and it's going to have to be reformed greatly. So anyway, why are the healthcare costs gone up? Well, yeah, we do have very high health care costs, but we have very good care as well. So, there's a lot of things that in other countries, and believe me, I've lived with Europeans and I've seen their healthcare system, and the notion of anesthesia in Germany was not well. I guess we've got some folks who could talk about that, but I just know from experience that some of my friends, actually, she was a Belgian friend of mine, and she had a tooth pulled and without a bit of anesthesia. So maybe it was a fluke, maybe it was something else. But I also had friends who had other health care. Anyway, it's complex, and I wouldn't say any healthcare system. If you look at the world's largest employers, I think number 3 is the NHS. That's the British healthcare system, the national healthcare system. So, in terms of bloated medical bureaucracies, we're not alone. Let's talk more about some of these other things. So, medical expenditures, yes, they have gone up, but there's a lot to do about that. There's we're a pretty litigious society. There's a lot of admin costs. There's a lot of malpractice. So, it changes. The Affordable Care Act, when they wrote the book, the Affordable Care Act was going to be the saving item. But in reality, regardless of what extreme you're on or whether you're in the middle, things are changing quickly. And the situation is that there's really not a champion for what's become Obamacare. You've got two different groups out there. If you want to just broadly categorize them as Republicans and Democrats, the Republicans were never in favor of this, so they're probably up for doing some sort of modification to it. And then the Democrats, this was more of a transitional type thing to get to a single payer or an actual socialized medicine. So again, they're not champions. And anyway, the system doesn't work so well now, and it was meant to do all these great things, and it hasn't delivered now. There's actually more people without health insurance than before it started. So if that was their primary goal, if you watch the news, you know that things didn't quite go as advertised. Why does it cost so much? So again, you can argue, we need to cut back on that, but yeah, when it's your parent, your grandparent, you want to do what's necessary. The duplication of tests and all that, sure. Sometimes, especially with the legal system, if those tests aren't done, it's going to come back to haunt the guy if bad things happen. So doctors do some burdens. So anyway, there is no clear-cut answer on this, but these guys are making the case that Obamacare was going to solve it. This aging baby boomers down there at the bottom, that is a situation that's just a demographic shift that is going to make healthcare more expensive. And in terms of if there is going to be a cure from Ebola, it you know likely is going to come from some clinic, some private clinic within the United States. So we pay a price for that. But anyway, there's worse things to spend money on. What is being done about the high costs? So again, incentives, preventive care. You know, these guys were apparently true believers, and maybe it'll work out one day. But anyway, like I said, not getting political here. What can you do to reduce personal costs? So the flexible spending account, there's going to be income limits on that, so you can price yourself out of that. But high deductible health plan, those type of plans are going to be non-conforming under the new standard. There used to be a thing, especially for a lot of folks who are probably in this class, where you're young, you're healthy, and your odds of going to the hospital are quite low. So why not have a super high deductible? And getting sick at your age is kind of a traumatic event, and it's going to be maybe a little traumatic financially to cover that deductible, but then you'd be covered, and so that worked fine. But the way the whole plan is structured, the young healthy folks have to pay for the older folks. So by definition, the rates have gone up on the younger folks, and the high deductibles are not allowed. So generic drugs, you're pretty much forced to that. I haven't seen, I've was military, and then also in the private sector. Most healthcare plans require you to get generic drugs and long-term, all that stuff. That's already there. So I don't know what more is going to be saved there, because that's already kind of down to the bone. And the generics, those are only available for drugs that have been, out for a while. If it's a brand new drug, appropriately, the company needs to recover those development costs, or they're going to develop new things. So again, there's two sides to every story. So what can you do to reduce personal costs? Again, if there's errors in there and unfair decisions, and it can be kind of a nightmare. I had a leg worked on, it's actually my foot. It generated 53 pieces of mail. I mean, it was just insane. So anyway, all that mail, every time somebody's writing a letter, and there is no value added from all that admin. So that would be a good thing to do to reduce that. And you do have some control. You can just look at some folks, maybe not so much in your age, but man, you get people in my age, and there's kind of two groups. There's some people that kind of just let themselves go, and it's like, wow, it's not a lot of quality of life to be had there, and it's going to cost them for healthcare costs. But again, we're trying to stick to personal finance. Now we're going back to 45 million have no health insurance. That number again is a bit political, because there's some people who don't care to have insurance. You can be self-insured. You can be, the ultra wealthy. Now there's not 45 million of those, but in this number also they're counting whatever the word of the day is for folks who are here who are not citizens. So again, where would they get health insurance, and will they be covered under Obamacare? So it's anyway, older population. Disability insurance. Yeah, disability insurance is a problem of late, and we'll talk more about that. For most folks, you get your health insurance through your employer. So if you're unemployed, that's a tough position. There are state and federal programs for that, but they're certainly not luxury type plans. And the employer subsidizes a large amount of the cost on most of those health plans. So now that it's become more of a cafeteria type setup, and cafeteria type setup being you get to choose what elements of a plan, and in case if you decline medical coverage, you get a bit of a boost actually in your salary. It makes it tougher. Now sometimes you have redundant coverage. You have somebody from a lot of people are working two jobs. Some people have a military retirement, whatever, so they can decline that coverage. But anyway, for the most part, it's still the setup where your employer is somehow involved in your medical insurance. So the 1996, this was the Health Portability Act. So a little bit of reform took place, several years ago. And also had some things about this portability concept. If you change jobs, you're not to lose your health insurance. But again, any of these laws that you're talking about, the concept of the Affordable Care Act or Obamacare changed a lot of that. A lot of times there are holes in some of the coverage, and if you happen to watch, news shows, especially, I don't know whether it's as bad on. I think they're all just as bad, but it's drugs you need to take or drugs that you took that you shouldn't have, and now we can sue these folks. And then it's all these TRICARE supplements or Medicare supplements or whatever supplements to make up some of the holes there. So tremendous amount of money spent on that kind of stuff, and but this insurance is just for the possible or partial coverage for things that kind of slip through the cracks. COBRA, this had to do with portability, so it's an older type thing, and it actually covered more than divorce. So looking at traditional setup, husband and wife kind of thing, and well, it could have been either one of them with the job and the health care that was associated with that job. You get a divorce, and not only you divorce, you lost your health care. So they came up with sort of a fixed as a bridge. But again, the Affordable Care Act, this was the stimulus, the Recovery Act of 2009, changed a little bit of that, but Obamacare is changing even more. So again, Recovery Act gave benefits for tax credits to employers if they would subsidize more health insurance. Probably not a super effective program. A good health insurance plan, this is very much academic at this point because it's been mandated what constitutes a good health care plan, and that's defined as a conforming plan. So all these different numbers, out of the box, they're completely wrong at this point. Limit out of pocket expense to no more than $3,000 to $5,000. Well, on a lot of these plans, under Obamacare, your deductible can be like $60. Well, not even your deductible. Your fees would be like $6,500. Now, sometimes they're subsidized, but sometimes they're not. So, anyway, for a lot of folks that have those huge, not even deductibles, just your premiums, that can, that constitutes an emergency in itself, and you're not even sick yet. You're just trying to pay the bill. So, again, I wouldn't get too wrapped up about it. Hopefully, if you're, still in college, maybe you can weather the storm and things will get sorted out in the next couple of years. But I would invest a whole bunch of worrying in a situation that I think is just transitory. So I'm not saying it's going to get better, but I don't think it's going to stay stagnant, stay still either. Types of medical coverage. So there used to be different options. Again, I'm not going to, hospital expense, surgical expense. They're just what they say. Individual insurances, but it's usually better to have an umbrella type coverage. Physician expense does not include surgery. So any of these limiting type things where you're just getting a partial coverage, not a big fan. You need the umbrella coverage because something like a life flight helicopter. There's some folks who got hurt pretty bad. I believe that bill was like $48,000. And, oh, by the way, they sent an ambulance, too, and they also charge them for the ambulance. So, anyway, silly things can cost a lot. And so you need to make sure that you have a good comprehensive coverage plan. Major medical expense insurance. So, serious long-term has a deductible, stop-loss provision. So, again, a comprehensive insurance plan should have all these elements where it pays for the hospital, the physician, the surgeon. If that's separate, it all needs to be included. But it's not a static environment. Comprehensive major medical. So that's what we're talking about. That's what you're looking for, something comprehensive. This dread disease stuff, that's kind of a silly thing where, well, yeah, you had cancer, but not the kind of cancer we insured for, or something else. And usually a salesman involved, and obviously he's making a commission, and anyway, not usually good. If somebody contacts you peddling something, it's usually not ideal. Usually better off to have a rough idea of what you need and then seek out that person rather than take some pitch from the internet or worse, a phone call. So hospital indemnity. Anyway, pays a fixed amount for each day you're in the hospital. If you're in the high risk group, But again, they know when you're in a high risk group. As you're getting older, or if you've got a history, these fees are going to be correspondingly higher. Dental insurance, quite quite prevalent. A lot of times it's employee sponsored, but a lot of times there's caps. Children with braces, you're still going to expect to pay a fair amount of that, and there'll be annual caps, and towards the end of the year you may have to pay more. So you need to look at the policy and see what's covered. Vision care, I've had those policies for a while, and I guess I should get out there and get the annual eye exams. But anyway, it's not very expensive. Dental insurance is not going to break you either. We're talking $30-$40 maybe a month on the dental, and maybe $20 on the vision care, I think is what I pay. So, and that's for family coverage, so not a great amount. Long-term insurance care. This is something, and this will never be covered really. It'll kind of fall through the cracks with Obamacare. This is, kind of the nursing home kind of stuff. $72,000 a year for a nursing home. So now, it's one of those things, to get it when you're young is fairly reasonable, and then as you're older, you see that $16,000 a year. So that's a pretty good chunk of money. So they're betting that you're going to possibly die a quick death, and they're hoping you don't suffer in a nursing home. And either way is not an ideal scenario. But anyway, don't have a whole lot to say on this, other than it is quite prevalent, and it forces people into some end of life situations that are really not pleasant, either with or without insurance. But your options for your family are going to be greatly diminished, and your children are going to maybe be greatly impacted financially if you don't have some sort of coverage, if you don't have the assets. If you have the assets, the self-insurance type stuff, then you're in good shape. Major provisions in a health insurance policy. So the eligibility, marital status, dependency. Again, the marital status, they're kind of assessing your risk, and the age. So, what kind of shape you're in. They'll look at your medical history. There's some, with technology, we'll see what happens, but some of these genetic tests where they can see if you're predisposed for something, we'll see how those things factor in. Internal limits, amount per day, per hospital. Some of these fees that are paid, especially on the government side, are to the point where the hospitals won't take you because they say they can't survive at those fees. So it may limit where you could go for an option. Major provisions, co-insurance, co-payment. So yeah, $12, $15, co-pay type stuff, and service benefits versus fixed amount. That can happen. What you may see, and we haven't really seen it that much yet, maybe I guess Costa Rica would be the place, but I spent a lot of time out in the Baltics for other reasons, for work and military kind of reasons and stuff like that. But man, the place was filled with dental clinics and all sorts of other businesses for doctors, basically from the UK, from the United Kingdom, who didn't want to deal with the bureaucracy and the low pay of working under the NHS, and they'd come out there and set up a private practice in Latvia and Lithuania and Estonia. Anyway, folks would come out there on a vacation, get their dental work done, and granted they're British, so it's not a whole lot of dental work. I mean, they could spend a lot, but they don't. Anyway, and those sort of healthcare vacations, and I think that's even happened to a certain extent in Costa Rica, where people, and the doctors can live quite well because the cost of living is cheaper there, or the malpractice insurance is cheaper, and there's so many less fees and bureaucracy that they get to practice medicine without some of the downfall. So you may see that even pop up as a kind of a Band-Aid quick fix to get us through some of the difficulties. Benefit limits, maximum number of days, exclusions, limitations, guaranteed renewable. Anyway, healthcare coverage, a lot of the stuff is becoming mandatory. So the flexibility in this stuff, there's minimums that are quite high, and but it also sometimes makes it prohibitively expensive. So we'll see what comes out once things are set. Reimbursements versus indemnity, internal limits, deductibles, co-insurance. Again, there's going to be less differences between the plans because there's now, this definition of a conforming plan, which in order for it to be sold, is going to have certain minimum limits. So you don't really have the flexibility, but you'll have to be able to afford it. The out-of-pocket limits, how much money you can have to pay, and then also sometimes there's caps, financial caps. But again, we'll have to see what comes out of it. Based on reasonable and customary charges, the figures are just going down to the point where some of the doctors say they just can't perform the procedures for that point. So anyway, there's a lot of overhead that will also have to be eliminated. Private source of health insurance. So you can always, there are, I guess in Canada it's actually illegal to have the private insurance. In the UK it's quite popular. They have these side policies, and they may be the ones that go out to the Baltics. But you're going to see all this stuff, Blue Cross, Blue Shield. That's going to be changing, and those companies are going to be probably a lot of them going defunct. Managed care. Prepaid health plans, again, HMOs, health maintenance organizations. They still exist to a certain extent, but you had, in-network and out-of-network and all these different things. And it's just ways to try to get the healthcare costs down. But, again, they're being supplanted by Obamacare. Preferred provider, so within the HMO, if you go to the one within the network, that's what they're talking about there. Home health care agencies, $72,000 for a nursing home. If you can put somebody in their home and you can pay some, nice person to come by for, say, $50,000 a year, they're doing very well. You're doing very well. You're in your home, so obviously you can see, the advantages to staying out of kind of that institutional environment. So I think that trend will continue because there's not necessarily going to be coverage. Obamacare, the Affordable Care Act, that kind of transitions to Medicare as people get older. So again, those limits are going to go up, but say around 67 or so, you're no longer under the Obamacare setup, and you might be going into Medicare. So you're anyway, different program, different limits. But home health care, I think, is got a lot of advantages for a lot of reasons. Employer self-funded health plans. So again, a company, if they have the resources, can just say we're going to do it and pay for it themselves and be self-insured. Healthcare accounts, health savings accounts. Again, there's financial limits. I don't make a tremendous amount of money. Well, maybe, but anyway, I'm priced out of those things, so I've never had the exposure to be involved in that. I mean, what they are is they're just savings accounts where it's a tax deferred type thing. You can put money in there and then draw against it. So it's not again, it's kind of a Band-Aid type approach. In Medicare, so these are the 65 and older, but again, they try and move those ages up, and certain disabled persons, which is it depends on certain cases. But anyway, you had the Part A and the B and the C, and you hear all these things, the Part D, and they talk about the donut hole and how they're going to, anyway, Medicare is basically, by and large, insurance for the elderly. But expect there to be means testing throughout the program. So if you, happen to stick some money away, you're still going to be paying. Medigap, so those are those coverage, those little, small insurance policies that cover part of it. And then Medicaid, this is for the folks who low income of all ages, just like it says. State administered with federal guidelines. So it's, healthcare. If you show up at a hospital, they, by law, they must treat you. And that sort of treatment for people who have basically nothing, they would be covered under Medicaid, for a certain amount. Unfortunately, a lot of it, though, is the hospital just eating it and then passing on that burden to their customers who have the means. So that's what makes it a little bit more expensive. Well, not a little bit, a lot more expensive for the other folks. Medicare fraud, sure. It's all over the place. It's a huge government bureaucracy, and there are incentives if you can spot some of the fraud, but again, it's just too vital, not vital, but too lucrative. So, Patient Protection Affordable Care Act. So, again, tax credits, pre-existing conditions, dropping coverage, preventive services. You can be classified as a child till age 26. Anyway, all that comes at a cost. Lifetime caps are eliminated, annual limits, restrictions. In theory, it would work out, but obviously there's a price to be paid, and we'll see what that is. HHS.gov. You can, some of these sites are the stuff of Saturday Night Live skits because they're a little tough to get onto sometimes. Disability income insurance. Okay, so now we've moved away from health insurance, and my apologies, but the topic is just evolving, and it's certainly not static. So, it's tough to lecture on a moving target. But disability income insurance, this is, quite prevalent. In fact, the program's growing, but not for the right reasons. Sometimes this has to do with, work-related type things, and if you are employed and now you're unemployable due to your condition, you need some sort of coverage to, basically make you whole so you can continue on. Now, there's private policies, and there's also some government type policies through Social Security. So on a private policy, what they're talking about is something 60 to 70% of your gross pay. And I actually have, a long-term disability, and I have a senior care type thing that hopefully I would never use, and then disability insurance. But it's something you should have, and especially if you're in a dangerous type industry. So does it go to 65 or for life? The waiting period once you're injured, 30 days, 90 days. 90 days is kind of a stretch with no coverage there. So obviously non-cancelable and guaranteed renewable are important aspects of it. Sources of disability income. So you've got the employer, and that's the shorter, the long-term one, and then you've also got Social Security. So with the buffoonery with the slides, I do not think it's not looking like it loaded up the second part. But anyway, we've got workman's compensation and regular disability insurance. So what I was going to show on here, and let me step and see if this next slide, no, it did not work. There's been a huge conversion of basically long-term welfare folks to disability insurance. And in particular, if you ever watch TV and you see like Bender and Bender is one of these big companies that does it. Anyway, what they do is they convert people from state welfare programs to long-term disability, and sometimes it's valid, sometimes it's not. But what that does is it's very good for the states financially, because it takes that burden of welfare, which is a state program, and puts it onto the federal government under Social Security Disability, which is a different program. So that's why the numbers for Social Security. In fact, I'll amend the slides and I'll put it on the slides that I'll hand out. But you can just see the astronomical growth of that program. That's made it quite difficult. So quite difficult for people to sustain. So anyway, let me see what else. Yeah. So in this slide deck with the second iteration of the slide load up, it didn't load those either the homework slide or the graphs I had added. So I'll put those back in. By all means, if you have any questions on the long-term healthcare aspects, or even the disability insurance, those things are going to continue. The viability of the Social Security in general and the disability that comes from that. There's going to be a lot of reform taking place, hopefully, and that should not. So that program hopefully will survive if they fix it. If they don't fix it, it's gonna bankrupt itself quite quickly. In terms of the healthcare costs and the healthcare provisions, we'll have to see how that situation evolves, because it's pretty dynamic right now. I'll try and put a couple more of those notes in there for you. In terms of the midterm, I've seen. I've seen relatively few problems that people are having in terms of accessing the test. So, by all means, if you are having an issue, let me know. You still have a couple more days to knock that out. But like I said before, certainly watch the YouTube video that's focused on the test to kind of prepare you for that. And let me know if there's any other issues. Other than that, we'll talk again next week. Thanks.
Recording stopped.